Top Med Talk.
Hello, I'm Joff Lacey and welcome to Journal Club Express on Top Med Talk. In this latest edition, we've selected a recent JAMA publication entitled Effect of Use of a Bougie versus Endotracheal Tube and Stylet on First Attempt Intubation Success Among Patients with Difficult Airways Undergoing Emergency Intubation, a randomized clinical trial. The paper is authored by Brian Driver and colleagues from Hennepin County Medical Center in Minneapolis. So in this study, adult patients had attended the emergency room of the author's institution from September 2016 to August 2017 and requiring an emergency intubation were randomized to undergo that procedure using either a Bougie facilitated or endotracheal tube and stylet technique. And all intubations used a Macintosh blade. The primary outcomes was the first attempt success in the subgroup of patients with at least one difficult airway characteristic. Now, they define this as an obscured laryngeal view from bodily fluids, airway obstruction or edema, obesity, short neck, small mandible, large tongue, facial trauma, or the need for cervical spine immobilization. Secondary outcomes were first attempt success in all patients, duration of the first attempt, and an incidence of complications such as hypoxemia or esophageal intubation. They recruited 757 patients and randomized them to the Bougie or the Stylet groups. And these two groups were balanced well in terms of patient and clinical characteristics, as well as intubation process measures. 380 of these patients had difficult airway characteristics, and again, split evenly between the two groups. And the first attempt intubation success was significantly higher in the Bougie group at 96%, compared to 82% for the Stylet group. Amongst all patients, again, the Bougie group was more successful with 98% first attempt success, compared to 87% for the Stylet group. And there were no significant differences in duration of the first attempt or incidence of hypoxemia. And in fact, overall, complications were infrequent and occurred with similar frequency in both the groups. So the author's conclusions are that the use of Bougie resulted in significantly higher first attempt success in emergency intubations, and therefore it may be useful as a primary intubation tool, not solely as a rescue device technique. They rightly heed warnings that these findings should be considered provisional until applicability to other settings and institutions is assessed. So that's it for this session. Don't forget to check out more on the Top Med Talk website, www.topmedtalk.com.
Top Med Talk.